Thanks for joining us. I'm Judy Simpson. A new Vermont law is now in full effect. It's a law designed to improve women's health. As of January 15th, Vermont healthcare facilities that perform mammograms must notify their patients about the patient's breast density. To find out what the new law means for Vermont women, we've called on one of the state's top breast cancer experts. Dr. Sally Hirschhorn is the medical director of breast imaging at the University of Vermont Medical Center and a member of the UVM Cancer Center. Thanks so much for coming in.
Well, thank you for having me, Judy.
Now, this new law centers on notifying women about their breast density. Can you first explain what breast density is and what the significance is?
Certainly. So when a mammogram is creating an image, the radiation, there's a small amount of radiation that's passing through the breast tissue and exposing either the film or the detector or whatever technology we use. And women's breast is composed of multiple tissues, fat tissue as well as glandular tissue that produces the milk, and fibrous tissue that supports the glandular tissue and the ducts. And if you see in this graphic here, the fatty tissue allows the X-ray beam to pass through, and therefore the image is darker. And the glandular tissue and the fibrous tissue doesn't allow the beam to pass through as well, and it turns out white on the image.
And what does that mean, that you can't see as well through the density?
Well, the implication is that since cancers are usually detected as white areas on a mammogram, if the image is whiter, if the background in the image is whiter, it makes it more difficult to detect cancer on a mammogram. And every woman is different and has a different breast density. And the breast density is not a constant throughout our lives. Breast density does tend to decrease with age. Here you're seeing a graphic of the 4 different types of breast density that radiologists classify. The first one on the upper left is mostly a dark image. It's called almost entirely fatty. The second one on the upper right, it has a little bit of more white tissue, and this is called scattered fibroglandular tissue. The bottom left image is heterogeneously dense. You can see that the image is whiter, and the bottom right image is extremely dense breast tissue where there's very little fat in that image. And the ability of cancer to detect, the ability of the mammogram to detect cancer on the mammogram is very high in the fatty breast, 98% accurate, but it goes down as we get to the higher and higher breast densities.
So the density actually acts as kind of a camouflage.
It does. It just obscures the cancers that may be there. In addition, the importance of breast density is that women with a higher breast density are themselves at a higher risk of breast cancer. It's a slightly higher risk, and the women with extremely dense breasts are about twice the risk of a woman with an average breast density, and the woman with a heterogeneously dense breast is maybe just 1.5 times the risk of a woman with average density. And here you see a graphic of, again, the 4 breast densities on the bottom from left to right, increasing in density. And I've shown this graphic in order for you to realize that it's not a uniform distribution in the population. If you look at the graph on the upper side, the upper shows that only 10% of the population has entirely fatty breasts, and only 10% of the population has extremely dense breasts. The great majority of us fall, 80% of us fall in the scattered fibroglandular on the lower right side, on the lower left side, and the heterogeneously dense. If you draw a line down the middle there, the left side of that graph are not dense. Almost entirely fatty and scattered fibroglandular are considered not dense. And the mammogram is very accurate in these women. On the right side, heterogeneously dense and extremely dense breasts, that's where we have to be aware. And that's where we will be notifying women that they have dense breast tissue.
That's 50% of the population.
That is 40, depending on the age, 40 to 50% of the population.
And you mentioned age is important, so the younger you are, the more fatty?
The more likely you are to have dense breasts.
Oh, really?
So as we age, we get more fat in our breasts and less glandular tissue. And not in everyone. The rate of having dense breasts is probably 60% in women in their 40s, and women in their 80s, it's only about 30%. So they're still significant number of women in their 80s who have dense breasts.
And so what's the problem with dense breasts? You can't read the mammograms as well, meaning that you could miss some cancers.
You can miss cancers, exactly.
And so let's talk a little bit about why Vermont adopted this new legislation. And is it something that other states have as well?
So this is a story of patient activism and engagement. And I want to tell you the story of Dr. Nancy Capello, who was a PhD in education in the State Department of Education in Connecticut. She ate healthy, she exercised, she went to her doctor regularly, she kept a healthy weight, she did everything she was supposed to do and went for regular mammograms. And after her 11th normal mammogram, a few weeks later, she felt a lump and she got diagnosed with a very advanced breast cancer. And she said, how did this happen? I did everything I was supposed to. Why did I get diagnosed late with a stage 3 cancer with positive lymph nodes? And her doctor said, well, Nancy, you have dense breast tissue. And she said, what does that mean? And the doctor said, well, you know, it makes it more difficult to detect cancer on the mammogram. And Nancy said, if you knew, why didn't I know? Why wasn't I informed? I might have chosen to do something else in addition to a mammogram. And after she went through her mastectomy and her chemotherapy, which was a very difficult ordeal, she tried to get physicians to disclose this information to patients and give them the information. And when they didn't, she went to the Connecticut legislature and petitioned them in conjunction with forming a website called areyoudense.org to get this message out to women everywhere. She was able to enact Connecticut's legislation in 2009, the first mandatory breast density notification legislation, with the goal of decreasing the rate of advanced breast cancer in women with dense breasts. And after Connecticut passed their legislation in 2009, this advocacy movement successively targeted more and more states. And Vermont is the latest state to pass. We passed this legislation in May, and it is now just now gone into effect. Here on the graphic, you can see the map of the current density legislation with the pink states, those states that have active legislation requiring mammography facilities to explain to women if they are dense that they have a slightly higher risk of breast cancer and difficulty in the ability of the mammogram to diagnose cancer.
That's hugely important information for women to know.
It is important information for women to know, and every state has slightly different wording to their legislation. There may in the future be a federal legislation that will bring us all together, but at this point there's ongoing legislation. So when women get their letters from us as a mammography facility, giving them their report, they will be told their specific breast density, and if they're dense, if they're heterogeneously dense or extremely dense breasts, the Vermont law will have us give them a notification that will say, your mammogram indicates that you have dense breast tissue. Dense breast tissue is a normal finding. Remember, this is normal. This is not a disease. A normal finding that's present in about 40% of women. Dense breast tissue can make it more difficult to detect cancer on a mammogram and may be associated with a slightly increased risk of breast cancer. And then it goes on to say that this information is provided to raise your awareness of the impact of breast density on cancer detection and to encourage you to discuss this issue as well as other breast cancer risk factors with your healthcare provider as you decide together which screening options may be right for you. So not every woman who has dense breasts automatically needs to have additional screening beyond the mammogram. It's a personal choice, and it's important for women to discuss their risk factors with their providers, because knowing your risk of breast cancer can help you decide if you might benefit from additional testing and what kind of additional testing might be the best for you.
And women really have to take a proactive role in this and really make some serious decisions about their health.
Yes, I think this is all designed for people to take control of their health. And this is a big step forward for patient advocacy and for patient and family-centered care. This isn't any longer about population health, it's about individualized health care, personalized health care.
So what other screening options are there for women?
So certainly the 3D mammogram, which we've talked about before on this program, the 3D mammogram is a big benefit because it can both increase cancer detection and as well as decreasing the false positive rate. And it's the only technology that can do both. It increases the cancer detection slightly, certainly increases the cancer detection in women with heterogeneously dense breast. It does increase the cancer detection slightly in women with extremely dense breasts, but not nearly enough. So women with extremely dense breasts may really want to consider additional screening beyond the mammogram, and the most popular, the most available technologies are ultrasound screening and MRI.
Mm-hmm. So what's the feedback that you've been getting from this new legislation and women learning about their breast density?
Well, it just started, so we really don't have a lot of feedback yet, and there are multiple articles published from different states with their experience as they rolled this out, and it's been very different in different states, so it'll be interesting to see in Vermont if many women choose to get screened or few women choose to get screened. And you know, Vermont is not one of those states that requires insurance to pay for this.
Which is a big obstacle.
This is a big obstacle and a big burden for women. And I think that things may change in the future, but women should check with their doctors and check with their insurance and inform themselves about breast density and what their options are.
And so we just have a couple of minutes left. What do you want to make sure that Vermont women know about their breast density in the law?
I want them to know that breast density is one of the non-modifiable risk factors for breast cancer, and there are certainly modifiable risk factors that you can do: maintain a healthy weight, get regular exercise, refrain from alcohol, keep alcohol consumption to a minimum, and don't smoke. Those are all things that you can do to be proactive about your health and decrease your risk of breast cancer.
And so, once again, this is something that women should be talking to their doctors about and coming up with a game plan and really finding out more about what their bodies are like. And also, to reiterate the fact that you should be doing monthly breast exams.
Monthly breast exams are a good idea, certainly for women to be familiar with how their breasts feel, but women shouldn't feel compelled. There are a lot of women with many lumps, a lot of cysts, and monthly breast exams are scary. And studies show that in these women, they're not that helpful. So it's really important for women to just be familiar and not feel compelled to do monthly breast exams. And that way, if they're familiar with their lumpy breasts or their non-lumpy breasts, they will be able to spot if something significant comes up.
And once again, if women have questions, what should they do?
Well, they should talk to their providers, and we've actually we're giving them letters now that we're information letters. We have posters up in our clinic explaining about breast density, and we've developed a very extensive website with resources where they can go for medically sourced information about breast density.
And once again, if you're told by a provider you get one of those letters after a mammogram saying that you have dense breasts, not to panic.
Not to panic. This is not a disease. This does not mean you have breast cancer. This just means that there are certain additional things that you might want to think about. And we're available to consult with women and help them through this type of decision after they've talked to their provider.
Because, as you said earlier, there are a number of tests you can take.
There are a number of tests you can do, or do no additional testing. It's a personal choice and depends on your goals and values.
All right, well, Dr. Harshorn, thank you so much for being with us today.
My pleasure,
Really
Judy.
Interesting information, really important, that I don't think a lot of women realize. So thank you.
Well, hopefully they will be more informed after this.
All right, thanks so much. That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.